So, hepatic functions. When we're looking at hepatic functions, we have to remember about the flow of blood from the body through the liver, where we're going to be flowing via the portal system. Every bit of blood that is passing through the body will pass through the liver sinusoids. In this case here, we deem that the liver has what's referred to as first pass function. That means that anything that flows through it, the liver will has the chance of metabolizing on it. That is, it will have a chance to absorb it and metabolize it. In this case here, we can say that the liver is going to go ahead and will function as a filtrating organ, where it's going to remove anything that is suspended within the plasma. This includes damaged RBCs, any type of foreign or endotoxin, any type of pathogen. The foreign toxin, the endotoxin, and the metabolic wastes or metabolites within plasma will interact with any one of the three types of cells that we see within the liver itself, whether it's the hepatocyte, the Kupffer cells, the stellate cells that are going to go ahead and function. All of these metabolites that get formed within the liver will get excreted either through the skin in sweat, through the skin in sudoriferous secretions, in the kidney via urine, or in the gastrointestinal tract, the alimentary canal via bile secretions. Now, one of the things that can happen with the sebaceous secretions is that some metabolites will get interwoven within the sebaceous secretions as the collagen proteins within the hair and the nail start interacting with the sebaceous and the sudoriferous secretions, which is why with some drug tests, they will go ahead and they will take nail and hair clippings, because what that is an indication of is how long the person's been exposed to those types of toxins, those types of drugs. Whereas blood and urine toxicity screens, drug screens, will only show acute changes. So when we talk about the liver, we're really talking about is we're talking about the right lobe in terms of excretory function, as the left lobe is primarily going to be involved with digestive functions. In this case here, we're going to talk about hepatocytes as well as other phagocytotic cells. We're going to utilize both active and passive transport, primarily through a symport-antiport mechanism. We're going to have cells that are undergoing large amounts of mitotic activity and have excessively short rates of cell life because of the rate of metabolism that they're undergoing. Once the cells can no longer go mitosis, they start to undergo uh, fibrotic changes within the cell itself. These fibrotic changes within the cell themselves are dependent upon TGF beta as well as inflammatory signals, which can lead to cirrhotic issues for the person. In terms of the cells that we see within the liver, we have four principal cells. We have two that are going to act as macrophages. Those are the hepatocytes and the Kupffer cells. And then we have two other cells that are going to act as immune cells, and those are the stellate cells and the dendritic cells. The dendritic cells are going to basically be able to instigate immune responses within the sinusoid of the lobule so as to instigate a non-self antigen response. Whereas the stellate cells are going to be responsible for the formation of fibrotic clots within the sinusoids. So when we talk about fibrosis and cirrhosis, what we're really talking about is we're talking about the formation of clots due to stellate cell activations. Now, the stellate cells are going to have a secondary function, and the secondary function the stellate cells are going to produce is regulating the life cycle of the hepatocyte itself. The Kupffer cells are going to be found within the sinusoid, and they're going to be macrophagic cells that are going to go ahead and metabolize things like ethanol, hemoglobin, so as to produce bilirubin. They're going to initiate TNF alpha responses as well as the formation of superoxides. They're going to respond to superoxides as well as small fragments of immune cells or digested cells which we refer to as lipopolysaccharides. So lipopolysaccharides are small chunks of the cell membrane that is left over following macrophagic activity and immune cell responses, or where we've had injury to the cell. What the Cooper cell is going to do is it's going to metabolize those lipopolysaccharide formations so as to allow them to be excreted, or it will integrate them into the formation of the low density lipoproteins for circulation and use in terms of transporting those polysaccharides as well as those lipid molecules from point A to point B. The hepatocytes themselves are going to be the principal cell that we see within the liver. These are going to be responsible for all of the metabolic reactions we're going to take a look at here in a second in conjunction with the Cooper cells. They're going to be actively involved with the production of bile and urea from the metabolites that they are interacting with, whether they are toxic or not. They're also going to be responsible for the storage of any materials, whether it's glycogen coming from carbohydrates or lipids coming from triglycerides. So one of the things that the liver does because of the hepatic portal system is it's going to be involved with first pass. And one of the things that can happen with first pass is that those hepatocytes get overwhelmed with metabolites that they have to process out. In processing out these metabolites, one of the things that happens is that they will start to store fatty acids within the hepatocytes, leading to what's referred to as a fatty acid syndrome. If it's coming from drinking, from excessive consumption of alcohol or from excessive consumption of drugs, it's usually referred to as an alcoholic fatty acid liver. If it comes from having excessive metabolites, however, particularly glucose and sugars, it's usually referred to as a non-alcoholic fatty acid. People who are morbidly obese, we will see having these non-alcoholic fatty acid liver issues because of the storage and the metabolism that goes into play as relates to processing out these excessive sugars. So we're going to take a look at the cycling of the hepatocytes here. So what are things that are going to stimulate the hepatocytes? Well, things that are going to stimulate the hepatocytes are things like IL-6, things like hepatic growth factor, things like TNF-alpha, as well as signals from the thyroid coming particularly from T3, insulin signals, norepinephrine signals, and epithelial growth factors, which will all stimulate the hepatocytes to go from their normal G0 phase to a G1 phase. The G1 phase, if those cell signals continue, will lead to the synthesis phase and then into the G2 phase, leading to more hepatocytes. However, if there's excessive amounts of TNF-alpha, we actually inhibit IL-6, which will inhibit the processing of the hepatocyte in terms of intracellular signaling, allowing it to go through its cell cycle. The other thing is that if TGF-beta gets produced in high quantities, we end up blocking the hepatocyte in the G1 phase, and it can actually lead to an apocytotic cycle being initiated by the hepatocyte. One of the things that happens with TGF-beta is that it's going to either block a cyclin or stimulate a cyclin. So what we want to do is we want to have cyclin E being stimulated. With cyclin E and cyclin D being stimulated, what ends up happening is that we're able to go ahead and have more hepatocytes being produced than what should be produced. This allows us to have the correct level of hepatocyte being produced. And by having the correct level of hepatocyte being produced, we're able to go about having normal cell processing. However, when we have excessive inflammatory signaling coming about through TNF-alpha and the inhibition that we get from TGF-beta, what ends up happening is that the cell itself starts undergoing its apoptotic cycle, and we stop actually cycling new hepatocytes. This is one of the things that happens within the sequence of events that we see within the cirrhotic changes that can take place within the liver. So one of the things that can take place in terms of damage and injury to the liver happens to do with when we have too much inflammation due to excessive oxidative stress within the sinusoid. This usually accompanies excessive amounts of metabolism going on, meaning that they're trying to clear a whole bunch of either endo or exotoxins. What this does is this activates stellate cells. When we activate stellate cells, what ends up happening is we change the growth factors around and we start to produce growth factors that, instead of allowing for normal cell cycling to take place, instead induce the fibrotic changes to take place. What the fibrotic changes do is it induces fibrosis. Fibrosis you can think of as a clot. And what this does is this starts to block flow through the sinusoid. As we block flow through the sinusoid, fluids start to collect within the sinusoid. As we start to collect more fluid within the sinusoid, we start inducing additional injury. This additional injury induces additional oxidative stress, which induces additional activation of stellate cells, which induces additional fibrotic changes to take place. If we allow this to continue without resolution, the end result of all of this is cirrhosis. You can think of cirrhosis as the end result of inflammation and clotting taking place within the sinusoid of the lobule of the liver. It's not a acute issue, it's predominantly a prolonged issue, and one of the problems with this prolonged issue is that it leads to a whole bunch of other metabolic issues for the person that go outside of metabolism and metabolic processes for the liver itself. The way in which the liver goes about doing its processing is through metabolism of what we usually refer to as toxins. The toxins can be classified as either being endotoxin or exotoxin. Endotoxins include any of the metabolites that we are normally producing, as well as microbial endotoxins. These are normal things that normal cells that we have a symbiotic relationship with are going to be releasing. The exotoxins is anything else, anything that we're consuming or anything that's coming from a metabolite, from a microbe that can be seen as being toxic. These are going to undergo differential processing. We have two distinct pathways here. The step one pathway will produce through redox reactions, hydrolysis reactions, and hydration or halogenation reactions, either superoxides and free radicals or intermediates. The superoxides and free radicals will be eliminated through sweat. The intermediates will undergo a secondary coenzymatic reaction. The secondary coenzymatic reaction will form reactive oxidative species. These reactive oxidative species can come about through degradation of the superoxides. The ROSs can either be eliminated through sweat or get conjugated into what we refer to as xanthines. Xanthines will then get eliminated either through urine or through sweat. The other thing that the intermediates can do is undergo what's referred to as a conjugation pathway. In the conjugation pathway, we're going to go through and have multiple types of reactions that will stick various metabolites together. This pathway here is going to need secondary coenzymatic factors such as vitamin A, vitamin C, vitamin E, bioflavonoids. The acetylation, conjugation, and glucouronation reactions will form things like bile. The bile, as well as the ROS, will get excreted into the duodenum to be released with feces, whereas some of it will become aqueous, will be utilized in urea formation within the liver, and then get transported via vesicles either to the sudoriferous glands to be eliminated as sweat or to the kidneys to be eliminated as urine.